Ladies and gents, welcome back. Our failing healthcare system has been a main topic in news lately, and it's no different for British Columbians here. A recent article from CBC News saying BC can't privatize its way out of long surgical waits. Supreme Court says, what now? And this has to do with Dr. Brian Day's challenge to the Supreme Court, to the medical system in British Columbia. Canada's highest court said it would not hear a Vancouver orthopedic surgeon's appeal to challenging BC's key limits on private healthcare, ending Dr. Brian Day's 14-year legal fight. Health Minister Adrian Dix celebrated the dismissal as a vindication of the public care system Thursday morning. As he did, more than 80,000 British Columbians were waiting for surgeries in a public system. Some from the north and the interior have been waiting for more than 2 years. My guest today is none other than himself, Dr. Brian Day. Thank you so much, Dr. Brian Day, for joining me today.
Oh, you're welcome.
So this was a 14-year long fight that you had with, it went all the way to the Supreme Court. And this is to fight for the rights of British Columbians to make their own choice on their healthcare. If they are not able to get the service in a timely manner with the public health services, to see themselves be served in British Columbia. But from talking to you, it sounds like other people, other members of the country, other citizens in other provinces are able to come here to British Columbia to seek that medical attention. It's just not British Columbians themselves. Am I wrong on that?
No, you're quite right. There are a few exemptions, we've discussed previously. Federal employees and prisoners and workers' compensation patients are exempt, but the peculiar situation is that Albertans can come to British Columbia and exit the queue in Alberta, and British Columbians can go to Alberta and exit the queue in BC. And this is something a lot of Canadians don't realize, that you're almost that if I go to Alberta, I have rights that you don't have as an Albertan. And same if you come here. And as I said, imagine the outrage if I could come to Alberta and drive my car over the speed limit or go through red lights when I felt like it, just because the laws didn't apply to me. And the point is, these laws that we were challenging, and when I say we, I do want to emphasize it wasn't just me or our clinic. We had 5 patient plaintiffs, 3 of whom were children involved, and elderly, 2 elderly people. That this was a constitutional challenge, basically saying that the Supreme Court of Canada has granted Quebecers the right to extricate themselves from their pain and suffering when they're on a government-mandated wait list. But this same Supreme Court of Canada refused to hear whether citizens from outside of Quebec should have the same rights they gave to Quebecers, and so it is a strange situation for a developed country to impose draconian laws on its citizens that say, we the state own your body, we the state decide when you can get treated. And I think, as I alluded to last time, back in 2021, the data from government data shows over 13,500 Canadians died on public wait lists without getting the procedures done. And, cynically, I say that's a way for them, the governments, to not have to spend the money to treat patients. It's actually quite bizarre. We have a unique system in that we are the only country on the planet where private health insurance is unlawful for medically necessary services. And yet we strangely, unlike other developed countries, we don't cover other essential services like prescription drugs or even ambulances and physiotherapy and dentistry. I mean, a dental abscess can penetrate through to the brain, and there's no law of nature that says dentistry should not be covered. So we don't have a comprehensive health system. It's not an accountable system. The public is being treated as pawns of a government bureaucracy.
It's terrifying to think that they're trying to push their way into the dental industry. Actually, I spoke to my dentist recently about that, and they were a little nervous about that prospect. But as you see throughout Canada, I've taken notice of this. Uh, when it comes to essential services that you have to go to the public hospitals for, long wait lines, not the greatest service. You get it when it gets to you, kind of service. But if you go into private medical, it does seem to be just like any other business. You get very good service for whatever it is. With dentistry being the one example there, but I've done physiotherapy and other things that are just not covered by our medical service here. Now, from what I understand, British Columbians are actually leaving the country, and they're being encouraged to seek medical service outside of Canada.
Well, not only are they leaving, they always have, but our British Columbia NDP government is actually sending cancer patients down to private clinics in Washington State, and at a great cost, 3 times the cost of what it would cost in British Columbia. And this just speaks to the demise of a once great health system that the government has let it implode. They're continuing to let it implode, and as you know, it's now impacting even emergency departments. Patients are suffering from poor access even to emergencies. And just to go back to your dentistry and so on. Imagine if the government takes over dentistry or takes over medications and pharmacy, or and then what are you going to do when there's a 6 month wait to see a dentist, or a 9 month wait, or a 1 year wait? What are you going to do because the government and the BC Appeal Court ruled on this, and actually came out and said, yes, it's a government decision to purposefully ration access to care as a cost saving mechanism. The BC Court of Appeal ruled that. The BC Court of Appeal also ruled that patients are suffering and dying on wait lists. And those, to me and to most of the media, it was actually shocking that the Supreme Court of Canada decided they didn't want to even hear this case. And of course, the reason is, and I can tell you, judges have said to me, and including retired Supreme Court of Canada judges, have indicated that they are ashamed of their colleagues, because this was because they're afraid of the issue. And of course, many politicians across the country are afraid of the issue, and they shouldn't be, because countries like Sweden and Denmark and Holland and Germany and New Zealand and England, they all have a mix of public and private. They all have a small component of private, and I'm not saying get rid of the public system, because I think we need a strong public system, but we have a weak public system that's ranked 10th out of 10 now amongst the rich countries, in all categories except one, and that is cost. We are the 10th ranked in access and equity, but we're ranked number 1 in cost. There's something wrong with that statistic.
That's absolutely wrong, and it seems to be on par with government spending and everything that we're seeing these days with our all of our governments across this big country. But big question for this is, what is the point of the Supreme Court if they're not going to make a decision on a case like this? How is it that you get to the very top court of the country and they can just simply refuse to even see the case? How does that happen?
Well, there's a former dean of the Osgoode Hall Law School in Toronto, who is now a superior court judge in Ontario. After his academic career, he went in to become a judge, and he has said that there needs to be accountability, and governments are not accountable, and the reason for the Supreme Court of Canada is to make governments accountable. And here we are, the court is simply not doing its job. The main criterion for the Supreme Court of Canada to hear a case is that it's of great national importance, which no one can deny. Healthcare is of great national importance. Even from the economic perspective, more than 40% of provincial, it's the single biggest cost item of every province. How can it not be of national importance? And they were faced with a BC appeal court that basically said, yes, people are dying as a result of the system. And then correlate that with the fact that every other country on the planet allows private health insurance. Every other country, even countries like the communist countries like China and Cuba, Vietnam, Laos, and so on, they all allow private insurance and private healthcare. The majority of hospitals in communist China are private, but the public system pays, as in Switzerland. If a patient in Switzerland, I lived in Switzerland for 6 months, worked there. If a patient in Switzerland cannot afford private access to the private hospitals, the government simply pays for them to go there. Just like the British Columbia government is paying for patients to go to private hospitals and clinics in the United States. It makes no sense because you're paying for economically, that is not good not a good strategy to pay for care in a foreign country.
Well, it just drives up
Especially
cost,
in the United States.
especially when you could have
But
these performed in Canada when we have people here that are doing the job and are willing to do the job. Now, where does this leave your case now? So if the Supreme
well,
Court doesn't want to see it, and I don't think there's a political will with the NDP government. I think you'd have to have a change of government before you'd ever see a will to push for a private option. But where does that leave you?
it leaves us treating. Honestly, sounds weird, but we're treating patients from other provinces, and other clinics in Alberta are treating patients from other provinces, and it makes no sense. Just a recent clinic I had, there were 5 Albertans. I was seeing 5 Alberta patients who were frustrated by long waits in the public system. On the same day, an Alberta surgeon was seeing 5 British Columbians because, as I said earlier, once you go across the provincial border, you're like a foreigner with more rights than the citizens of that province have. And to me, I think that's just wrong. I'm not calling, and we're not calling for, quotes, privatization of the public system. We think, as in Britain or New Zealand, or you only need a small percentage of competition to make the bureaucrats accountable, and the hospitals and the governments are not accountable. And of course, as you alluded to earlier, members of parliament, and sadly, the same judges who refused to hear this case at the Supreme Court of Canada are exempt from that law. They're allowed to go to private clinics, and I have treated federally employed judges at our clinic and received payment from the federal government for their services. So that's how, if you like, almost corrupt the system is. That this is to me, it's like the former Soviet Union, where if you're on the central committee, you have privileges that the others don't have.
And it's mind blowing to think that communist China has a more free medical system for for patients to make choices than in our own country here in Canada. Now, we were talking before we got to the show, and I wanted to discuss this because the amount of time that people have to wait for these procedures, whatever that happens to be, uh, especially in young children, it could be very detrimental to their health long term. Um, how are we coping with this?
Well, you're right, and the reason, I mean, my my kids are all grown up now, but I had six kids, and I would, a parent who's had, as a parent, you know that children are developing, and they cannot be kept waiting, and yet some of the worst wait lists in the country are for children's treatment at children's hospitals, and to me, that's unforgivable. I mean, children, we have to be the voice of children's rights, and and they're suffering from rationing of care to a greater degree probably than adults are. And a child, I recall an email I got from a mother, and literally it said, "Dear Dr. Day, can you please help? My 3-year-old is waiting for a tendon release on her foot. The foot is now bending into a deformed position, and I can't straighten it anymore. But she's on a wait list, and we can't get her into hospital." This is terrible. This is a young infant who cannot get access to treatment. And cynically, I say children don't have a vote, and so maybe politicians don't care about children. But I do think it's now up to the politicians to make those changes. And it's kind of, we can always blame politicians, but then we also have to look at who elects the politicians. And so I think the Canadian people have to take this up, because they have a responsibility to make politicians, as the judge in Ontario said, we have to have accountability. This judge in Ontario actually said accountability should be a requirement under the health acts of every province, that there has to be accountability. And if care is being rationed, then someone has to be held accountable for it. When there's harm being done to patients, children, there has to be accountability. So now the ball is in the court, so to speak, of the politicians. They have to act. They have to change this. And as the last time we spoke, I used the hockey analogy. We're ranked 10th in equity and in performance, overall performance, alongside 10 developed rich countries. We're ranked 10th, but we're ranked number 1 in cost. And the reason is we have the most inefficient health system of all of those countries. And the reason for that is we have a monopoly government system, and I cannot think of any monopoly that serves the person needing the service well. They don't need to. They have a monopoly. There's nowhere else to go unless you leave the province or the country. And so I think politicians are to blame, but then we have to accept blame for electing politicians who are not strong enough to tackle this problem.
Well, I think, yeah, as voters, we've been sleeping on the job. We've been not paying attention enough to what's happening in our country. Most Canadians still argue that we have one of the best healthcare systems in the world, and they just have no idea. So I think this is what's so important about having people like you on the show to talk about this. So thank you so much, Dr. Brian Day, for joining me today and discussing this story. And hopefully we can have you back again in the future.
Okay, Clyde. Take care.
Thank you.